All right, guys, we're going to get started. So this is Rob with ACMG. I hope everybody's well. I want to welcome David Maxwell. He's the National Key Account Executive with United Health One, and he's going to be quarterbacking today's presentation on the Triterm Medical Plans. So guys, UHC is number one for us. They have a full suite of products for the under 65 market. In my opinion, it blows everything else away. During this call, we're going to keep everybody on mute. Any questions, just please drop them right in the chat box. Thank you. We're going to jump right into it. David, I'll turn it over to you.
There we go. Can you see my screen, Rob?
Yep, good to go.
All right, perfect. All right. Let me just do this so I can actually... Where is, there we go. All right, cool. All right. Well, again, Rob, thank you for that introduction. Again, my name is David Maxwell, National Account Executive with United Healthcare. So today we're going to be going over our Triterm product. Obviously, we're in the middle of open enrollment for ACA plans and such, and for a lot of people, that is the best avenue for them, right? It could be because they have pre-existing medical conditions that they need covered right away. It could be because of their income. But for a lot of people, maybe a different path is what's best for them. And so that's where we come out. I know this is an oxymoron, but our Triterm short-term plans, right? So we have a 3-year short-term plan. Again, I'll admit that's an oxymoron, but it is filed on a short-term chassis. So one thing I do want to kind of cover, as Rob mentioned, we're kind of the leader in the industry when it comes to health insurance. My division has been doing health insurance for almost 80 years, okay? But for us, being a healthcare carrier is more than just paying claims and having doctors. It's the big picture, and to kind of share what you'll be representing when you're offering a United Healthcare plan. Just kind of share some of the things that we did during the past year and a half. We provided more than $1.5 billion in initial assistance, including customer premium rebates to support people affected by COVID. For those who write Medicare Advantage, customers we waived all cost sharing for them for primary and specialist through September of 2020. We also accelerated nearly $2 billion to healthcare providers last year to help support their liquidity needs. We invested more than $70 million in local communities in need and protect the healthcare workforce. We converted all of our cafeterias. So the building I typically work in has about 800 employees, and we have a nice sized cafeteria. We converted those cafeterias to provide more than 75,000 meals a week for people in need. Also, United Healthcare, we pioneered a non-invasive self-administered COVID-19 test. I know I've taken this many, many times. So anybody who's gone and just had it where you put a Q-tip up your nostril, United Healthcare is actually we're the ones who invented that COVID test. Okay, and then we also launched a free nationwide emotional support line for COVID as well. So again, more than just paying claims, it's how are we investing our dollars back in the community and helping out others as well. So our Triterm state availability map is what you see here in blue. Pretty much, about half the states out there, right? We based on the certain laws of other states, some states don't allow more than 6 months of coverage. Some states don't allow more than 12 months of coverage. So we did file this in multiple states, but here's the states we got approved for this 3-year product. My government disclaimer here is this is not an ACA plan. It does not have a minimum essential benefits as defined by ACA. So what we did though is this product is more designed like the pre-ACA. I've been with United Healthcare for 13 years, almost 14 years. And, back prior when I started, we would do full massive underwriting on policies, get medical records, and someone could buy a plan and keep it for, 20, 30, 40 years. Now those have since gone by the wayside, but we did design this product pretty much like that, except obviously with a limitation of 3 years. So first thing I'll cover is kind of one of the great things about the Triterm plan is pre-existing conditions. So although we don't cover pre-existing conditions in the first 12 months of the policy, but we do cover them in the second and third term, okay? So again, unlike, if somebody needs something covered right away that's pre-existing condition, then ACA might be the better route for them. But if it's something that, hey, I've got a little bit of high blood pressure and maybe some cholesterol, and I can take care of my, lisinopril on my own for the first 12 months, but you'll cover it in years 2 and 3. Or, someone says, yeah, I had hip replacement, 9 months ago. All right, that's fine. We just won't cover your hip for the first 12 months, but we'll cover it after that. So pre-existing conditions are covered. They're just covered after the first 12 months. Now, when I say that too, kind of a disclaimer here, so if you've got a customer who's a diabetic, it's not where like, okay, let's sign him up for a Triterm plan. And then, he'll just have to wait 12 months to have his diabetes covered. Not true. So we do have underwriting guidelines, and a diabetic would be an automatic decline. So now, we do cover diabetes if they are diagnosed that during the policy, but just they'd be declined on underwriting as a condition that we just don't pass through underwriting. Okay. So it is one application for the full 3-year terms. And actually the first term's 364 days. It's just the way the laws are written, and the second 2 terms. So, someone starts an effective date of January 1st, their deductible would reset on New Year's Eve, because again, 364 days of coverage on that first term. So then their second policy would kick in, deductibles reset after 364 days. So we have 3 plans. And so, I mentioned how long I've been with United Healthcare. So for those of you who've been doing health insurance prior to 2010, and you wrote United Healthcare, you might, look at these plan names and they might be familiar to you. So the Copay Select, the Plan 80, and the Plan 100. We actually have pre-ACA plans that are still on the books. I looked up the other day. The first 2 policies I ever wrote 13 years ago are still on the books. That's how long they could stay on there. So it's the same plan names: Copay Select, Plan 80, and Plan 100. And I'll cover these. So on all the plans, you have a deductible. And as you can see, if there's a family involved, then it's a max of 2 deductibles per family. So that means if I'm a family of 4 and we each have our own $5,000 deductible, if I hit my $5,000 and my son hits his $5,000, then we waive the rest for the rest of the family, and everyone kicks into their co-insurance. In that co-insurance, on the Copay Select plan, after deductible, it's a 70-30 co-insurance for an additional $4,500 out of pocket. On the Plan 80, it's a 80-20 after the deductible for an additional $2,000. And then on the Plan 100, once they meet their deductible, everything else is covered. So at first instinct, you could say, well, hang on here. If David chooses a $5,000 deductible on a Copay Select and Rob chooses a $5,000 deductible on a Plan 100, something big happens. David's going to owe $4,500 more than Rob is. You're absolutely correct. And for some people, that's why the Plan 100s are favorite. I will tell you the Copay Select plan is by far our most popular plan. So about 60% of our sales are the Copay Select plan. And the reason being, which I'll cover here in a little bit, is there's a little bit more upfront benefits before they reach their deductible. Obviously, a much higher out of pocket, but the price point's also a lot lower too. All the plans have a maximum of $2 million of coverage for the 3-year term, and that's per person. So on doctor visits, on the copay select plan, each person gets a $50 copay for history and exam for their first 4 visits. Anything after 4, it's repriced at our contracted rate, and the client pays that, and that counts towards their deductible. On the Plan 80, Plan 100, that's the way it works as well. So on a doctor visit, somebody goes to the doctor will file the claim with us. We're going to reprice that as long as they're in network. We'll reprice that to our in-network price. Client will pay that, and that counts towards their deductible. So on the Plan 100, everything that's covered gets repriced. Everything the client pays counts towards their deductible. So whether it's a doctor visit, MRI, CAT scans, surgeries, hospital stays, prescriptions, everything counts towards their deductible. Once they reach their deductible, then we cover the rest 100% for the rest of that term. On the Plan 80, it works the same way, except once they reach their deductible, then it's an 80-20 co-insurance for an additional $2,000 out of pocket. And then we cover the rest, okay? Now, on the copay select plan, though, you also get $75 copays for urgent cares. So urgent care on the Plan 80 and the Plan 100 are deductible and co-insurance, just like everything else. But again, on the copay select plan, it's a $75 copay for an urgent care visit. 2 things. One is there's unlimited amount of urgent care visits, so there's no limit on those. Number 2, that's an all-inclusive copay. So what that means is, somebody gets hurt and they go to urgent care, and let's say they need to do an X-ray and put a cast, on their leg and such. All of that is a $75 copay. All right, it's all inclusive. Now, obviously, if they send them down the road to another facility to get an X-ray done, then that's a separate charge. But anything done within that urgent care visit is a $75 copay. Preventive. So Preventive is covered. It's basically MAMS, PAPS, PSAs for adults, and in children immunizations and such. On the Plan 80, Plan 100, it's deductible and co-insurance. On the copay select plan, the client pays a $50 copay, and then we will actually pay the next $200 of the claim. And then anything on top of that, the client would be responsible for. Typically, when someone's going for a wellness checkup, all the blood work and stuff, once it's repriced, it's under that $200 mark. So, typically, clients just out that $50 copay for the preventive. Now, there is a 6-month waiting period on preventive only in that first term. So if you have a plan that starts January 1st, preventive is not covered in the first 6 months, but then it's covered after that. And in years 2 and 3, they don't have to wait 6 months. I mean, if they want to have their wellness checkup the very beginning of the next term, that's perfectly fine. Emergency room, all the plans is deductible and co-insurance. Now, I will say for illnesses, all right, if someone goes to the emergency room for an illness and they're not admitted, then there's an additional $500, okay, that they have to pay. It's not because, we're penalizing someone to go to the emergency room. We just want to have people use the emergency room for what it's meant for, which is an emergency, okay? Ironically, I was in the emergency room last night. One of my children had to go there for a medical purpose. And as I'm sitting out there in the waiting room of the ER, I probably saw 30 people walk in. And out of those 30 people, 2 of them should have been there. Okay. One guy pretty much sliced his finger off with a saw. And he was basically just dangling off of the tip of his finger was dangling, right? The other person was in a car accident. The other people that were in there, one guy said that he couldn't get his blood pressure down, but he also skipped his blood pressure medication for the last 2 days. And when they took it, when he walked in, it was like 140 over 85. Another guy said his shoulder hurt, although he was moving it around. So again, let's use the emergency room for what's needed for. Again, you have urgent care visits at $75 copay. You have your doctor visits. And of course, there's a telemedicine product that you can also add on as well. Hospital stays, surgeries, x-rays, labs, all deductible and co-insurance. For prescriptions, the Plan 100 and Plan 80 is deductible and co-insurance at the network pricing. On the copay plan, Tier 1 drugs is a $25 copay. Tiers 2 through 4, there's a $500 deductible per year. And then after that $500, then it turns into copays. Now, like you, I can look at that $25 copay for Tier 1 drugs and think, my goodness, I can get, a generic drug at Walmart for $4. And if you can, then do it. That's absolutely true. I do the same thing. Okay. But there are Tier 1 drugs out there that are more than $25, even if you use GoodRx or other programs. So if you can get it for less than that, then don't show your card. But if it's going to be more than that, then show your card and get your $25 copay. Now, I mentioned earlier about wellness and preventive, all right, and what's covered. So this kind of shows you all the different categories. So you can see here on all states, pretty much, the mammogram, pap smear, colonoscopy, adult immunizations, HPV screening, HPV immunizations, EKG, cardiac stress, blood test or analysis, bone density screen. Those are all things that are covered. And what covered means is that they'll get the network pricing, and then they'll pay that reprice amount and counts towards their deductible. Of course, on that copay plan, they just pay a $50 copay, and then we cover the next $200. Okay, so really when it comes to it, the only thing, if you see there, the STD testing is not covered except for Georgia, and then it only covers chlamydia testing. Again, want to show that wellness chart. Obviously wellness is covered different on ACA, so this is not an Affordable Care Act plan because it doesn't meet the essential benefits. We're not covering pre-existing conditions from day one. It's not guarantee issue. We're not covering maternity and things like that. Now the network, this is also when it comes down to usage of the plan. Okay, when you're looking at an Affordable Care Act plan, all right, that plan is only good in their home state. Well, with the Triterm plan, as well as our short-term plans as well, it utilizes the United Healthcare Choice or Choice Plus network, which is a nationwide network. So on the Choice network, that just means it's an EPO. They can go to any doctor within our network. You do not need a referral, right? So, if you want to go to MD Anderson in Houston because you're diagnosed with cancer, you can do that. They are in network. You want to go to Johns Hopkins, you want to go to Mayo Clinic, those are all in network. So you can go to any provider without a referral in the network. Now, if it's a state res of Choice Plus, it's the exact same network. The difference is you have out-of-network coverage. However, with our network, we have 1.4 million providers across the country, 6,500 hospitals. You really have to look hard not to find an in-network provider. If you list out every hospital in the country, right, from Seattle, Washington to Key West, Florida, 85% of those hospitals are in our network, okay? So again, vast network, which means huge savings. So I want to give you a couple examples of this. So just so you know, I am not violating any HIPAA laws because these are actual claims of myself, okay? So this is one for blood work that I had done. You can see here the charge. Now this was in January of 2020. So we had not met our deductible at that time, of course. But you see here the blood work, and this is going to LabCorp, right? The blood work was billed at $722 on the top and $202 on the bottom. And you see the adjustments. Again, that's just because of our network. Has nothing to do with, that I'm on a group policy or whatever, that I'm an employee. That's the United Healthcare network repricing strength. So the claim on the top, for some reason, United Healthcare did pay $27.15. I didn't argue about it. I just accepted it. But even if you add that back in, that top bill at $722, I would have paid $81. The bottom bill was $202, and I paid $17.58. So again, the strength of our network is where, because when you're looking at plans, right, it's easy to look at brochures and cost of premiums and compare other carriers. The hard part, though, is how do you compare A, network repricing, and B, speed. We pay our claims on average of 8 business days with 97% accuracy. All right, so I'll give you an example. This is another one of my claims. Right, so I had neck fusion surgery last October. First thing I want to point out at the very top, you'll see here that even though my date of service was 10/26, it took the hospital, almost 3 months to file the claim. Once they did, we processed it in 1 day. So this was actually for my surgeon and the facility. And the biggest thing I want to point out is, they billed $7,700. We discounted it by $4,800. Now, at that time, we'd met our deductible, so we were in our co-insurance. So I didn't have to pay the full amount. I only had to pay 20%. But you can still see there, though, that $7,700 bill was discounted by $4,800 just because I have United Healthcare Network. This second bill is the anesthesiologist. Again, they filed the claim a little bit quicker. They filed it in less than a month, and it took us 6 days to process that claim. And my guess is, I just want to take a little Gantt here. My guess is, see if I'm right. So November of 2020, 17, yes, I was right. So one reason it took 6 days is because there was a weekend in there, okay? So it actually only took 4 business days for us to process that claim. And again, you can see the huge discounts there. Now, on effective date, whenever you sign somebody up, unlike on short term, they cannot choose a next day effective date. If somebody wants to apply today, then the earliest effective date is 5 days down the road, okay? So no next day effective dates on this, but again, it's just 5 days after they apply is the earliest effective date. They will get one ID card. The ID card will cover all 3 terms. Now, obviously, if they need additional ID cards, they can definitely call in and get those. But my point here is, it's not like, you're going to get a new card every single year, because sometimes that confuses hospitals and such. Like, oh yeah, we filed that claim on the ID card we had on file. Well, here's my new ID card. So then they got to reprocess claims and everything else. So it's the same ID card, same policy number for all 3 years. Also, if they cancel at any time, we will refund any unused premium. So let's say somebody has, they're paying month to month, of course, so there's no penalty for canceling early. So let's say, they bought the plan to start December 1st, they paid premiums, they keep on paying premiums. And let's say it's August and they've paid their August premium and they call us up August 5th to cancel. Well, then we'll cancel that policy as of the next day. So that'd be the 6th. And then we'll refund them back those 24, 25 days of premium that they didn't use, right? So, if somebody cancels on the Triterm plan, we'll cancel as of the next day. and then any unused premium will refund back to them. I mentioned pre-existing conditions earlier, how they're not covered in the first 12 months, but then they would be covered in years 2 and 3. Now, to buy the plan, the primary has to be between the age of 19 and 63. A little advice here: if you're writing a couple and they're in that 60-year-old range, always write the youngest person as the primary. Okay, there's no difference in price of who's first and who's second. The price is going to be the same. However, the policy will end when the primary person turns 65. So let's say you're writing a couple and you write the person who is 63 is first and the person who's 62 second. Well, it's a 3-year plan, but once that person who was 63 turns 65, the plan ends. So that younger spouse will lose their coverage with a year to go. So if you flip them around and write the youngest person first, then that policy will stay in force all 3 years. And just when the secondary person turns 65, they'll just drop off the plan, and then the plan stays in force. Okay. Children, obviously children can be on the plan with their parents, and a dependent can stay on as long as they're under 26 when a plan goes into effect. They can stay on for the whole period of time. So again, you write a mom, dad, and 25-year-old kid. That kid can stay on the plan until they're 28. Now, if the primary passes away, then we'll just move that secondary person up as the primary. Okay, so unlike turning 65, if the primary applicant passes away, we'll just move the secondary person as the primary and then continue the policy. Now, we do underwrite these policies, okay? So, there's an application they fill out, answer a bunch of medical questions. Then what we do is 2 things. One is we look at the answers on the application. Another word of advice is be very accurate when it comes to prescriptions, okay? When it comes to prescriptions and the cost and if we're going to rate them up or whatever, the type of medication they're taking, the name of it can make a big factor. Okay, we've had people declined for their cholesterol medicine, and a broker says, "Well, wait a minute here. I thought cholesterol was fine." It is fine. However, the medication they're taking is $400 a month. So how do you expect a $400 medication to be covered when you're only paying us $200 a month in premium? Now, sometimes what we find out though is, whoa, I'm not taking that medication. Well, what are you taking? I'm taking the generic of that medication. Well, that makes a big difference. So I'll give you an example. I take a certain medication, and if anybody asks me, what do I take? I tell them the name brand of it, but I don't take the name brand. I take the generic version. And so if I ever have to fill out an application, I always put down the generic version because, again, any misinformation could be bad because what if the drug I'm taking only costs $5, but I put the name brand down and that name brand's $400? We're going to underwrite it based on that, even though they're not taking that. So just be accurate when it comes to their prescriptions and the names of them. So again, it goes through underwriting. We'll review it. We'll check the answers to the questions. Then we'll also bump it up against our claims. Okay, so we do not pull an MIB when we underwrite, and we do not do a script check. What we do is we have access to every claim within United Healthcare. Okay, whether it's an individual policy, a group policy, Medicare, Medicaid, ACA, it doesn't matter. We have access to every claim. And so we'll bump that up against our claims to say, did we receive any claims that had a diagnosis code of heart failure? Okay, I'm just trying to throw things out here. So maybe the client said, no, I don't have any heart issues. However, there's a claim from 3 years ago with a diagnosis code of heart failure, then we're going to decline that policy. Okay, so that's what we check: the answers to the questions, and then internal claims check, and that's it. Now we can either issue the policy or we can rate it up. We could say, hey, listen, you know what? We'll cover this from day one, but we're going to rate you up 10% because maybe the cost of your drugs is too much or something like that. Or of course we can decline the policy. Now, if there's multiple people on the application, we can just decline one person and have the policy keep on going. Okay, so it's not like everyone has to be approved. We could just say, you know what, this person's declined for their medical conditions. However, we'll still insure the rest of the family. Other thing too is when you're quoting, make sure, so this height weight chart is on the broker portal. Make sure you review this first, okay? Because you always want to quote somebody in the right height weight category. Just this week, I had somebody say, wait a minute here, why did their rate, I started quoting it, but when they started filling the application out, their rate jumped up. I said, did you check their height weight? No. All right, so when they filled the application out, they had to put their height weight in, and then that's what changed their quote on the application. So just make sure you look at this first, because what you don't want to do is you quote them as optimal, right? And then it's somebody, it's a male who's 5'11", 250, and they're actually a standard 2. So we don't want any of those surprises for your clients. It'll help out the persistency and actually the effectuation rates. So I mentioned earlier about like diabetes. Here are some of the most common unacceptable conditions: AIDS, HIV, Alzheimer's, ALS, autism, bipolar, cancer, cerebral palsy, Hep B, Hep C, COPD, emphysema, Crohn's, ulcerative colitis, being pregnant or adopting. That also includes a father. So, if my girlfriend or spouse is pregnant, or I am, we are looking to adopt, that goes for me as well. Okay. Cystic fibrosis, pulmonary fibrosis, diabetes. We do accept somebody who's had gestational diabetes, but just not any other diabetes. Even if someone says I'm pre-diabetic or I'm borderline, if they're being treated for diabetes or been diagnosed, then it's all in. So Down syndrome, if they've been in the hospital, confined to a hospital in the last 12 months, other than being, having a baby, heart or circulatory system disease or disorder. So again, we're talking about heart disease or circulatory disease disorders. Someone who's on blood pressure medication does not fall in that category. Someone who's on cholesterol medication does not fall in that category, okay? We do accept people with controlled blood pressure and cholesterol. MS, MD, organ transplant recipient, paralysis, Parkinson's, rheumatoid or psoriatic arthritis, schizophrenia, stroke, thrombosis, substance abuse, addiction, or unexplained weight loss in the last 12 months, okay? Again, all those things are in the broker guide as well. I mentioned earlier rate ups. So we can rate up one of three things: height, weight, which we shouldn't have to rate up for that. You should know that when you do the quote. Tobacco would be a rate up as well. And then of course, again, medical conditions could cause a rate up. I mentioned earlier how we do underwrite individually. So if it's a family of 4, we could decline just one person out of the 4 and keep the other 3. Now, all of our plans, or most all of them, are in the association. So FACT, the Federation of American Consumers and Travelers. That's $4 extra a month, and that's for the entire policy. I will point out, though, there's many, many great benefits as being in that association. For example, there's a $20,000 accidental death policy built in for each person. They can also get reimbursed, $500 a day for being in a hospital after each day starting the 4th day of an accident. There's also up to $25,000 available for medical evacuation if someone's more than 100 miles away from their residence. So lots of different benefits in that association for them. There's scholarships actually in there as well. So, for people who have kids going to college. To pay their premiums, initial payments by credit card EFT, and then ongoing payments are credit card or EFT as well. Now, there is a one-time $40 application fee in most states. That does vary. So, for example, I think Mississippi, the application fee is $9. A couple of states, I think the application fee is actually refundable if the person gets declined. But so pretty standard as far as that goes. And then bundling. So if you do sell additional products, so let's say you sell, dental, vision, Healthiest You, which is our telemedicine product. Each policy will have its own separate policy number. However, and there'll be two different bills. So a client will have one draft for their Triterm policy, and then we'll draft one draft for all their other ancillary products. So if you sell an accident plan, a telemedicine plan, dental, vision, hearing plan, so you sell those 3 additional plans, they'll have one draft for their Triterm plan, and then one draft for all 3 of those plans combined. Okay. And that's all I have for you. So I'm looking at the chat box. I don't see any questions right now. I don't know if people were holding them to the end. But if you want to put any questions you might have in the chat box, I'd be more than happy to answer them.
David, great presentation. Want to thank you for taking the time today. The Triterm product definitely is a great option for folks. It's definitely been a pleasure to work with you and everyone on the United team. And the feedback from all of our brokers and policyholders has been excellent.
Great. Thank you very much. Yeah, I mean, the Triterm plan has been just a wonderful thing. I hear people all the time like, my gosh, I can lock in 3 years of coverage and not have to worry about it. It's been a great thing.
Exactly. I think you did a great job of covering everything. I don't see any questions coming in. Definitely want to thank you again. I want to thank everyone on the call for attending. Any product or contracting questions, please reach out to Agent Services at acmgsales.com. And we definitely look forward to helping everybody grow their business. And we're wishing everybody much success and hope everyone has a great open enrollment. Thank you, guys. Everybody have a good day today.